Good afternoon, everyone. I'm going to discuss an abstract of ASCO GU symposium this year. This is a safety and efficacy of Durvalumab in combination with Neoadjuvant gemcitabine, cisplatin, or carboplatin in patients with operable high-risk upper tract urothelial cancer. This is a French study, multi-center French study. Coming to epidemiology, the UTUC is relatively uncommon, accounting for less than 5% of all the urothelial cancers and less than 10% of all the renal cancers. And then the background of the study, all of us, we know most of the studies include of this upper tract are included in the bladder, but there are increasing evidence to show that this upper tract are different from the bladder, both on phenotypically and genotypical differences are there. This may account for why the natural history of UTUC is different from the bladder, with more than 60% of these patients present in advanced stage compared to only 15 to 25% of bladder patients, and the management of both are different in the terms of both surgical and medical management. And the bladder, we can see there is a genotypic difference in landscape, especially the bladder. The most common mutations what we found is TERT, TP53, PIK3CA, and retinoblastoma gene, whereas in UTUC we see there's more of CDK, N2A, MLL, and FGFR mutations. And this high-risk urothelial carcinoma has a poor 5-year survival rate with less than 50% in PT2, T3 patients and under 10% for PT4 tumors without any peri-op management. And a radical nephrourectomy was with a bladder cuff excision is a current standard, but this leads to loss of kidney function, limiting post-surgery treatment options like cisplatin-based therapies. And the only phase 3 trial is the POUT trial that all of us know, which showed improvement in DFS with adjuvant gemcis. The rationale for the neoadjuvant in this is that because of the poorer prognosis of this disease, with 5 years survival is around 5 years survival with 69% recurrence-free survival and 75% cancer-specific survival, and the renal function is declined post-surgery. And the benefit of neoadjuvant, like all of us know, that treat systemic disease early, improve the pathological response rates, and enhances the tolerability before the kidney loss. And the combination, there is a synergy between the immunotherapy and chemotherapy. And the why immunotherapy? In urothelial bladder cancer in Niagara morning, Dr. Hatira explained there is a EFS and OS benefit with that, with the HR with a hazards ratio of 0.68 for PFS and overall survival with 0.75. And there is a pure one study of bladder with their immunotherapy, neoadjuvant immunotherapy had a pathological had a PATH CR of about 37% of patient and PT less than 1 in about 55% of patient. And there is another trial in UTUC with PUT2. This is a feasibility trial in that only 10 patients they studied in a pembrolizumab neoadjuvant, but only one patient had a pathological CR rates. Although the small size, there is no promising signals of activity from the single agent pembrolizumab in this patient. This shows that this is a different disease compared to the bladder. And the study what we are going to discuss now is the INDUCT. This is a phase 2 trial, French trial, multi-center, inclusion of ECOG less than 1 with high-grade disease on tumor biopsy or a high-grade disease on urine cytology or infiltrative aspect of renal pelvis or ureteral wall on imaging with T less than 3 or N plus or minus N1. And the primary endpoint of this study is pathological CR rates. The study divided into 2 cohorts with based upon EGFR of the patient. If it is more than 60, patient received Durvalumab with gemcis 4 cycles and then went for surgery. Or if EGFR is less than 60% and more than 40, then those patients received carbo with Durvalumab. And the patient enrolled 50 patients, out of which 30 patients are in gemcis Durva arm, and 19 patients are in carbo and Durva arm. This is a study population. As we can see, most of these patients are male patients with a smoking status, and most of the tumor locations is pelvic calcaneal system, and most of the tumors are in T2, T3, more than 3/4 of the patients are in 2 to 3. This is a histological diagnosis. In this study, they didn't made biopsy as a mandatory. We can get a urine cytology or biopsy. About 44% of patients got a urine cytology, and rest of the patient got a biopsy and both the cytology and biopsy. Like we can see, there is a discordant between the biopsy and the cytology. Like biopsy is showing low grade, but the cytology is showing high grade in about 7% of patients, and the biopsy is showing high grade and the cytology is showing low grade in about 57% of patients. But there is a match between the cytology and the biopsy in about 21% of patients in high grade and 14% of patients in the low grade. And the results of the study, the primary endpoint was pathological CR, where we can see about 13% of patients in GemCis with Durva arm had a pathological CR compared to 5% of patients in Gem Carbo Durva arm. And we can see most of the patient, about 75% of patients had response and pathological, there are like pathological T1 or T2. And the secondary endpoint safety, there are minimal grade 3, grade 4 toxicities, which is mostly because of a chemotherapy. And the renal function at the baseline and they compared renal function at baseline and after 4 cycles, there are about 7% patient lost the had a fall in the EGFR in cisplatin arm. And the limitation of this study is the biopsy, as it's not mandatory. Only 50% of these patients had a biopsy, and there is no control arm with a platinum-based chemotherapy alone. And as most of our adjuvant trials included upper ureteric tract, there is no adjuvant IO in this. And these are the preliminary results, and the DFS results are still awaiting. But the key points of this trial is that this is the first phase 2 trial with the neoadjuvant in UTUC, combining immunotherapy with platinum-based chemotherapy. And the combination has showed to be safe and does not negatively impact the surgical outcomes, which is the gold standard for these patients. And the study demonstrated promising results in reducing residual disease, particularly with cisplatin-based therapy. And there is actually, based on this, there is a phase 3 trial being planned. This is introductory. Thank you.